Hi, this is Trudy with Heal Wellness and Therapy, and today we are going to be focusing on those of you who have neck and low back pain, or you've had a history of having just neck pain and a history of having just low back pain. We know through medical research that as our spine ages and as we form habits with our body, we have certain parts of our spine that move more than others. There is a particular researcher whose last name begins with Yang, who has shown us that the rib cage and the thoracic spine is the key to gaining movement and preventing further progression of neck and low back pain. So what I'm going to do with my friend today is we are going to be working on some exercises and activities using a bolster to improve the mobility of the rib cage and a very specific key muscle in the low back called the quadratus lumborum that will help you improve the ability of your thoracic spine and your rib cage to move more so that your low back and your neck have to move less. We are going to begin today with a breathing exercise in sitting. I like to begin any sort of therapeutic yoga class with a breathing exercise, really just to center yourself and get your body a little bit more relaxed. The breathing exercise that my friend and I are going to do today is an alternate nostril breathing. So it's pretty easy to do, but let me talk through how to set up for it so that you have yourself in an efficient posture before you begin to focus on the breathing. So begin with having yourself on a surface that's high enough that you can have an open hip angle. Well, what that means is that your knees are sitting below your hips. You can have your legs in a tailor sitting or crisscross applesauce if you can remember what you learned in elementary school. Or you can have your legs gently out in front of you with your knees softly bent if you've got any sort of knee issues that may impede you from having your legs crossed. Once you're in that position, allow yourself to go through lumbar and pelvic motion by tucking and tilting your tailbone and finding that position that for you feels like it's halfway between both of your edges. Then make sure that you're sitting nice and tall, your rib cage is on top of your pelvis, and that your rib cage is far enough forward that there's just a little bit of weight into your legs. Alternate nostril breathing, we're going to be using the right hand. The left hand can just gently rest onto the left thigh. With alternate nostril breathing, we're going to use our thumb and our ring finger. And so you have an option with these two middle fingers. You can either fold them down or you can keep them up and rest them on your forehead. So let's take our thumb and place it where our right nostril is, and take our our ring finger and place it where our right nostril is. Two middle fingers, either place them up kind of in your brow area or just bend them under so that they're out of your way. Very nice. Alternate nostril breathing. What you're thinking of doing is inhaling through one nostril, exhaling through the other nostril, and inhaling through that same nostril and exhaling through the opposite nostril. I want you to think a moment for seeing somebody on a teeter-totter. And all that you're trying to do with alternate nostril breathing is really focus on getting the inhale deeper into one side of your body, and then the inhale deeper into the other other side of your body. Also the exhale out of one side of your body and the exhale out of the other side of your body. Simply moving back and forth. So let's go through that. So with your hands in position, go ahead and begin with your thumb against your right nostril. Take a nice deep belly breath and inhale into your left nostril. Close your left nostril, open your right, and slowly exhale that air out. Keeping the right nostril open, inhale in. Closing the right, opening the left, and exhaling out. Inhale into the left nostril. Close the left, open the right, and exhale out. Inhale into the right. Close the right, open the left, and exhale out. Inhale into the left. Close the left, open the right, and slowly exhale out. Inhale the right. Close the right, open the left, and exhale slowly out. And inhale the left. Close the left, open the right, and exhale slowly out. Finally, inhale the right. Close the right, open the left, and slowly exhale out. Release your hand. Thank you. Sometimes you have to go after that because you get your sinuses also open. That's a very good benefit of alternate nostril breathing, is it really does open up the respiratory system. Well, now we have our respiratory system up and running. The next thing we're going to really begin working is introducing movement to the spine and the rib cage in sitting. So let's get ourselves so that our arms are resting onto our thighs. We're going to do cat-cows in sitting, just like you could do them on hands and knees. This is just a modified way of doing that. So what I want you to do is I want you to start with an inhale. Let your belly come forward, arch your back, lengthen up, tailbone up, and then as you exhale, pull the belly button in, let the spine come down, lengthen the neck, and look into the belly button. Good. Inhale, imagine lengthening the front of your body as much as you could. Really think about here. And then as you exhale, curl everything under. Very nice. Inhale, lengthening, lengthen, 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 and really lengthen where my fingers are. Very good. And exhale, curling everything under. Let's do one more time. Nice deep inhale, lengthening through the entire breath. And one last exhale, curling everything under for your cat. Coming back up to the center, doing a little bit of opening through the side body. So take your right hand rested onto the bolster. Make sure you have the ability to bend your elbow. Let's take an inhale and lift your left arm all the way up. And as you exhale, bend the right elbow and slowly side bend. Now, make sure to push a little bit of weight into that left sit bone so you don't come off of your base of support. Deep inhale into the side of your rib cage, and then as you exhale, bend a little further. Nice deep inhale in, and exhale, side bend. Last time, sit into that and deeply inhale through the side body. Exhale, gently side bending. Inhale the arm all the way up, and then exhale, relaxing the arm down. Taking the left hand, placing it onto the bolster, making sure your elbow can bend. Taking an inhale, reaching the right arm up, and on the exhale, side bending over, making sure to sit into the right pelvis. Now, deep inhale into the rib cage, and as you exhale, gently softening that left elbow and side bending. 2 more breaths. Deep inhale into the rib cage. Exhale, side bend, and 1 more. Nice deep inhale inward, and exhale, side bend. Finally, inhale the arm back up to the ceiling, exhaling the arm down. Very nice. Now, we are going to move on to transitioning to using the bolster to open up through the rib cage and thoracic spine. So, begin to scoot yourself off the front of the bolster. We're going to position the bolster on the mat so that we can lay our rib cage on top of the bolster to do some side bending opening of the rib cage and the thoracic spine. So let's take your left hip bone and bring it to the back side of the bottom of the bolster. In that position, stack your knees one on top of the other. Shin bones run parallel to the side of the mat, and the feet are kind of gently stacked one on top of the other. From this position, gently allow the rib cage to lay up and over the bolster, resting the left arm downward, head laying down onto that right shoulder. Now, for some individuals with neck issues, this is a position of provocation. So what I would like you to think of is you can find what I call the pose position if you have issues with your neck. What you're going to do is you're going to take your left hand and rest it against your head like you're posing as a model. She's doing such a good job right now. Very good. From this position, with yourself in whatever of those two positions are comfortable for you. What you then want to do is take that right arm, inhale it up, and as you exhale, bring it up and over the body. Now that you have your arm into that bending position, you have your side bending through your rib cage, the only thing we have left to do is see if we can create a little bit more length through the lower part of the rib cage. So take an inhale and straighten your right leg all the way in the air. And then as you exhale, gently drop it down onto the floor. Now, in this position, imagine the entire rib cage like an accordion being side bent open. Each and every one of those ribs now finding space in between. So what we want to do is figure out where we're the tightest. For her, it's all right here. Once you can find out where you feel the most tension in this, that is where you're going to place your breath. So take a nice deep inhale into the side of your rib cage, and then as you exhale, can you find more space through the arm or lengthen the leg further away? 2 more breaths. Nice deep inhale into the side of that rib cage, and as you exhale, creating that fold over that bolster. 1 more breath, deep inhaling in and exhaling, side bending. Very nice. Taking an inhale and bringing the right leg back up. Taking an exhale and gently bringing the arm back down. From this position, very easy to transition to the opposite side. Top arm comes onto the bolster. Take a deep inhale, and as you exhale, tighten your abdominals and push yourself back up to a seated position. Now, simply doing a 180-degree turn and turning yourself so that you are with your pelvis on the right side to the bottom of the bolster. In this position, knees are stacked, shin bones are once again parallel to the side of the mat, and ankles are stacked as well. From here, gently allow the entire rib cage to lay all the way down over the bolster. Again, you can do the same thing with your neck. If you know you have a sensitive neck, you can rest your hand onto your head and support your head in a more neutral position. If you do not have neck issues and there's no problem with doing right side bending, allow your neck to lay down onto the right arm. From here, gently take the left arm, take a nice deep inhale, bring it up into the air, and as you exhale, begin to side bend as the arm comes up and over the body. Beginning to see that side bending through the entire upper part of your body. Now taking that top left leg, inhaling, lengthening that leg long, and as you exhale, dropping it down onto the mat. Just as we did on that opposite side, where is it that you are the tightest? It could be lower, it could be middle, it could be higher. Identify for you where you have the greatest tension, and that's where I want you to focus on your breath. So taking a deep inhale into the left side of that body, and then as you exhale, lengthening that arm and that pelvis further away. Nice deep inhale, creating length on the inhale. Exhale, creating space for tension, for movement to happen. Last time, deep inhale in, and exhaling, lengthening. Now on the inhale, slowly bringing the leg up and in to stack on the top. On the exhale, slowly dropping that left arm down to the side of the body. To comfortably get back up, placing the left hand on the bolster, taking a deep inhale, and on the exhale with a contraction of the abdominals, pushing yourself back up into a seated position. Now, we're going to be moving on to hands and knees. So as she does that, we're going to place ourselves so that the bolster is between our knees and our hands. So once we know hip distance of our knees and we can gaze back and see that our ankles and feet line up with our knees and hips, simply take the hands and bring them to the front side of the bolster so that the hips stack up on top of the knees. In this position, lengthen the back of the neck, tuck the chin in to find a nice spinal alignment. Hands are shoulder width apart, index fingers pointed forward, thumbs inward, elbows are soft but not firmly extended, and the outside 3 fingers are spreaded outward. Weight is in the index finger and the thumbs, equal weight to the knees and equal weight to the hands, equal weight to the right side and equal weight to the left side. Going through just a few cat-cows, just like we did in a seated position, beginning with the belly and inhaling the belly and the spine first, creating length as you lengthen the neck and lift the tailbone up, and then exhaling, pulling everything up and in, lengthening the back of the neck, tucking the tailbone under. Inhaling, really sinking the belly and focusing on sinking that spine, lengthening neck and tailbone. Exhaling, curling everything up and under, finding the most length you can through the tight areas of our body. Finally, inhaling, focusing on sinking where we are the tightest. And exhaling, focusing on curling where we are the tightest on the backside. Now gently walking your hands up onto your bolster and just slowly sitting back into a child's pose. Dropping the head on the bolster, giving yourself a moment before moving on to the next exercise. Deep inhale to stretch out that low back. Exhale, relaxing there. Nice deep inhale into the belly, into the low back, and exhale. Now we are going to move on to having the pelvis on top of the bolster. There's a really easy way to do that. Oftentimes people do it in very funny ways and they fall. So I'm going to teach you how to do it the easy way. So we're going to start with the left hip on the bolster. So coming up onto your knees, take your left hip and place it to the back side of the bolster so that your entire bottom leg bone feels like it is sitting on top of the bolster. From that position, take the left arm, gently bring it onto the floor, and then carry down with the right arm down to the floor and slowly lower yourself down as you stack your knees, one on top of the other. In this position, the entire pelvis now with the leg bones is sitting on top of the bolster. So as we create length and space, we'll be able to really tackle that lower part of the rib cage where we have a lot of tension and tightness that contributes to low back pain. So in this position, we will do the same thing we did when our rib cage was over the bolster. So starting with the upper arm, take an inhale and lift the arm upward. And as you exhale, gently allow the arm to come up and over the body. With the bottom arm, you have several options. You can gently rest your head so that it's in a comfortable position. If that is too much side bending for you, you can also gently bring your arm straight out in front of you. Whichever is your comfort is fine for this particular pose. Now that we have the length through the upper part of the body, this is key. This is the focus for this lower half of the body. It all is a matter of what this top hip is doing. So let's take a nice deep inhale, lengthen the leg upward. As we exhale, we want to think about taking that heel and bringing it all the way to the floor. As we do this, we begin to peel that rib cage off of that pelvis. Now, focus on where the tension is the tightest. Take the deepest inhale into that belly that you can, and as you exhale, can you make your pelvis longer? Can you reach your arm further? 2 more breaths. Nice deep inhale into that side of that body. Exhale, feel the length through the body, through the leg and the arm. Last one, deep inhale and exhale. Lengthen, lengthen, lengthen. Very nice. To get out of this posture, inhale, stack the right leg on top of the left leg. Exhale, bring the right arm up and over. Now, gently place the right hand onto the floor. Take a deep inhale, and as you exhale, tighten your abdominals and use the strength of your upper arm to push yourself up onto the bolster. Now, gently turning yourself to your backside on the bolster, taking the hip all the way to the other edge of it so that the entire leg bone rests on the bolster, knees are stacked. To carefully lower yourself down, drop both hands down onto the floor, and then as you drop both hands down onto the floor, softly bend the elbow, dropping the shoulder down without falling off the bolster, resting the head down. Your options for your bottom arm are to rest underneath your head or to rest in front of you. Stack both hips on top, making sure that the pelvis is stacked on top of the bolster. The focus now going to be on that top low back area of the left side. So going through the same thing we did with the right side. Begin with an inhale, reaching the fingertips up, and as you exhale, gently reaching up and over your body. Then starting to tackle through the leg. So inhale, lengthen the leg up and back first. As you exhale, slowly begin to lower that leg and that heel towards the floor as you start to tackle that tension on that side. Once you're there, it's all about the breath. So take a deep inhale into that low back side body, and then as you exhale, lengthen the pelvis, lengthen the wet leg, get that heel to the floor. Deep inhale into the rib cage, and then as you exhale, lengthen from the arms and from the legs, finding more space into that rib cage. One more deep inhale in, and exhaling, finding length. Very nice. Gently inhaling, bringing the knee back up. Exhaling, returning the arm to its resting position and then placing it on the floor in front of you. And to carefully get yourself back up onto the bolster, place the left hand on the floor. Take a nice deep inhale, and on your exhale, tighten your abdominals and push with that left arm to get yourself back up and then gently off of the bolster. Very nice. Now moving the bolster to the side, allowing your person to gently lay down through their right side. Lay down with your head here for me, please, through your right side. Now, a little tidbit I like to tell all of my yoga practitioners. Be very careful when you're rolling to your back that you don't do a reverse sit-up. So don't sit on your tailbone and fall back onto your back. If you want to protect this lumbar spine and make it last the duration of your life without injury, always lay on your back through laying through your side. So now that she is gently laying through her side, all that she is going to do is slowly and allow herself to roll over onto her back. And as she rolls onto her back, without creating any forced flexion through her low back, she is now ready to move on to a different position. Now, what we're going to do is finish with a spinal twist. In this position, roll the shoulders underneath, making sure that it feels like the chest is gently open. Go through a motion of the pelvis to make sure that the low back is in its resting position. So as you inhale, arch the back, allow full extension, just like cat-cow. As you exhale, tilt the pelvis, feel the entire back touching the floor. Now gently find that middle of the road between those two motions and rest the pelvis in that position. Once you are there, gently allow your right leg to slide down the mat, taking your left foot, placing it on top of the right thigh, taking your right arm, gently grabbing the left knee, and slowly bringing the left arm just gently out to the side. Keeping the left arm engaged onto the floor, thinking about that left shoulder blade touching onto the mat and not moving away from the mat. Now today we have worked on the rib cage primarily to gain motion, so that's where we're going to focus with our spinal twist. So with your first inhale, imagine pushing your rib cage down into the floor. And as you exhale, allow the twist to come up to the rib cage, but don't let the rib cage move. Very nice. Now, push the shoulder blade down into the floor. Take a nice deep inhale. And as you exhale, allow that rib cage to twist, twist, twist until you get to that point that if you go any further, that shoulder blade begins to lift. Now to counter rotate through the neck and the upper body, lengthening the neck, settling the chin, tongue to the roof of the mouth, and then just very gently counter rotating the neck to whatever is comfortable for your rotation. Imagining from the shoulder blade up is resting gently on the floor, and that rib cage is completely twisting to the side, allowing opening to occur. Now with the focus on the rib cage today, to ease neck and back pain, really focus on the breath being into the rib cage, not into the diaphragm. So take this moment to kind of harden and soften the abdominals a little bit. And as you inhale, imagine that inhale expanding that rib cage outward. And as you exhale, maybe, just maybe, you get a little bit more of that spinal twist. 2 more breaths. Inhale into the rib cage, keeping the abdominals tight. And exhaling, relaxing. Oh, that was beautiful. Let's do 1 more breath. Nice deep inhaling in and exhaling. Now, getting out of spinal twist is just as important as getting into it. So starting with lengthening the neck, settling the chin, and counter-rotating through the neck. Resting the shoulder blade down onto the mat. And then slowly focusing on just the rib cage coming back onto the floor, followed by just the low back onto the floor, just the pelvis onto the floor, and then finally uncrossing the leg, resting the left foot on the floor, sliding the right leg up. Once the right leg is up, gently kind of moving the pelvis around, going through an inhale, arching the low back, exhale, tucking the tailbone under, finding that middle of the road again, and then sliding the left leg down, taking the right foot, placing it on top of the left thigh, allowing the left hand to come up and reach the right knee, gently letting the right arm come out to the side of the body. Once in that position, it is about the rib cage today. So the focus is on this right rib cage pushing down into the mat. Taking the first inhale, lengthening through the spine, and then as you exhale, take the hip, take the pelvis, take the low back, go as far as you can before that rib cage begins to lift. Now, focus on that right shoulder blade pushing down into the floor. Take the deep inhale you can into your spine, and as you exhale, let the remainder of that twist be the rotation that you have gained through that thoracic spine. Now that you're there, counter-rotate through the upper body. Lengthen the neck, tuck the chin gently in, close the eyes, rest the tongue on the roof of the mouth, and gently counter-rotate into a right rotation. Now let the focus be the rib cage. So just gently harden the abdominals, hold them in place. Take your inhale and let the inhale imagine that rib cage expanding up and out. And as you exhale, just see if motion occurs. Deep inhale into the rib cage, exhaling further into that twist, finding that mobility through that thoracic spine and rib cage. 1 more nice deep inhale in and gently exhaling. Slowly countering out of the rotation, bringing the neck back to neutral first. Resting the rib cage first through the shoulder blade, then slowly bringing the rib cage down first, followed by the low back, followed by the pelvis, then the knee, allowing the left leg to slide up, and gently 1 knee at a time, bringing your knees to your chest, hugging the knees nice and tight, just to get a little opening through the hamstrings and the gluteals, since we didn't focus on that today. Taking a nice deep inhale, and on the exhale, pulling the knees into the chest, lengthening the neck, settling the chin, resting the tongue on the roof of the mouth, maybe even closing the eyes. Just a reverse child's pose here. As you inhale, feel that belly pushing into the thighs, and as you exhale, imagine those knees going deeper into the chest. 1 more breath, and exhale. Slowly releasing the feet back down to the floor 1 at a time. Once the feet are to the floor, gently allowing 1 leg at a time to slide to the corners of the mat, resting the arms up and outward, feeling that the shoulder blades are underneath the body, making sure there's not too much tension in the low back. You feel like you're in that neutral position between your arched back and your flattened back. Lengthening your neck, settling your chin, closing your eyes, resting your tongue to the roof of your mouth. And now allowing your body to be still. As your body begins to be still, what happens in the brain is it has to begin to reprogram all of that new motion that happened here. So as you're laying here, with every breath you take, your brain is beginning to find different ribs in different areas of the middle part of your spine that you have gained motion in today. therefore limiting all of the excess motion we do every day to our low back and every day that we do to our neck. So rest your body. Feel that inhale through the rib cage occurring. Feel the exhale relaxing. And as you normally breathe, begin to imagine the rib cage onto the mat. When you inhale, feel the rib cage pushing into the mat. And when you exhale, imagine your entire body getting heavier. With every inhale, resist a little bit into the mat. Every exhale, soften that resistance. When your body comes into a thought, like when is the next meal? I forgot what I was doing. Just accept it, acknowledge it, and bring your body back to the focus of the breath. Inhaling, pushing into the mat. Exhaling, finding a way to soften. Because as you're softening your body, you're learning to focus your mind. You're learning to calm your system. You're learning to heal your body. Slowly beginning to wiggle your fingers and your toes. Maybe some circles with your wrists or your ankles or bending your elbows. And then when you're ready, just gently bringing one knee up, followed by the other. Allowing yourself to just slowly roll over onto your side. And as you roll onto your side, taking a moment there to take a nice deep inhale and a gentle exhale. And another nice deep inhale. And then on the exhale, pushing that top hand up as you find yourself into a seated position. And face one another to end class. Hands are to our hearts. And there's smiles on our faces. We're doing such a good job of healing our bodies. Take a nice deep inhale in and exhale out. Namaste.
Namaste.
The highest in me salutes the highest in you. Thank you.
Thank you.
Well, thank you so much for practicing with me today. Now, before we end, do you have any questions for me?
Yes. When we were over the bolster and I had my hand over it, you said, feel where the tension is the worst. How do you do that?
Got it. Well, it's a very good question to ask, and it's actually very common, and it is an issue not only if you're doing a yoga pose or a stretch or anything relative to just normal breathing. So let me define tension for a second. I just happen to have an elastic band behind me here. So what happens with our body, with habits, is that certain areas of your body tend to have, rather than a relaxed resting state, they tend to be in a state of tension. And so the only thing I want to do when I'm helping you identify areas of tension is to, when you inhale into something that's already tense, it creates more, I want to say, sensors within the muscles to let your brain know, oh yeah, that's tight. So that as you exhale, you can hopefully get that area of your body back to a state of relaxation rather than habitually staying tense and not even knowing that you're tense. So I hope that answers
Yes,
it
does.
for you.
Thank you.
So to end today's session, remember to like this video. In the comment section, if you've got any questions, ask them. I promise we'll answer. Also, please feel free to subscribe to our YouTube channel. And with subscribing, make sure that you select that bell so that as we have new releases of videos, you will be notified. Thank you and have a nice day.